Health officials have identified a measles case in a young child in Northern Virginia. And Virginia's Department of Public Health says the preschool-age child visited several healthcare facilities in the region, potentially exposing others.
News 4's Mauricio Casillas looks into what health officials are doing now about the spread and what you can do to protect your children.
There are now 2 confirmed measles cases in Northern Virginia. Health officials say the 2 are not related. The latest case involved a child described as 4 years old or younger who recently traveled internationally. And take a look at the potential exposure sites. PM Pediatric Urgent Care in Woodbridge on January 13th, Inova Children's Emergency Department in Falls Church on the 15th and 16th, and the Inova Fairfax Hospital Women's and Children's buildings in Falls Church on the 17th and 18th, with health officials saying there was possible exposure on floors 2 through 10 during that time. Pediatrician Dr. Krupa Playforth says she's concerned there could soon be more cases discovered.
That initial case was an international traveler, but because of the extent of the exposure, the duration, the different locations, and the fact that a lot of people took their kids to urgent care in the ER last week, I think that it's possible that we may end up with community transmission.
The Virginia Department of Public Health tells me they've been working with local health departments to make sure that patients who may have been exposed are alerted. Health officials say the best defense is the vaccine. Dr. Playforth says one of the tricky things is diagnosing measles before those red bumps appear.
What most people don't realize is that the initial symptoms of measles, those first few days, are cough, congestion, pink eye, fatigue, fever, which can be mistaken for so many other illnesses right now.
And while state health officials say vaccination rates for the disease remain high in the DMV, in some spots across the country, there are greater concerns. According to the CDC, the U.S. saw more measles cases in 2025 than in any year since 1991. A troubling trend that's led George Mason University epidemiologist Amira Roas to believe that the virus could lose its elimination status in the country.
You know, a lot of times when you would see diseases become endemic, it would have to do with war, broken infrastructure, inability to access vaccines, inability to access healthcare. Unfortunately, where we're heading right now, because in some communities, it almost looks like we're going back in time to a place where there were no vaccines.
A reminder that experts say public health requires communities to work together, not against each other, to be protected from diseases. Mauricio Casillas, News 4.